Hi, my name is Shine Franklin, and I'd like you to imagine that you're going to go into an ultrasound. During that exam, your sonographer suddenly goes silent. Eye contact stops, your facial expressions start to change, and the air in the room suddenly feels heavier. Even though they do not say anything, the patient can create a million different things that are going wrong inside of their head. That is the power of nonverbal communication. As a student studying sonography, this topic is particularly important to my future career because communication is such a big part of it. Through my clinical shadowing experiences, I have seen firsthand what real patient-provider interactions look like. I've also researched this topic using credible, well-supported medical and healthcare sources. This has helped me better understand how nonverbal communication impacts patient experience. Nonverbal communication plays a very important role in patient care because it explains how the patient interprets the provider's behavior, it affects how they respond emotionally, and it's especially critical in sonography where the patients are often looking for answers in silence. This topic matters to all of us because there will be a day where we're in the room with a patient or we are the patient in the room talking to the provider. At some point, these moments may be stressful, but knowing how to communicate without words can make these difficult situations so much easier to handle. Today, I will explain what nonverbal communication is and why it is so important in healthcare. We will talk about how patients are affected by this communication emotionally, and why this type of communication is particularly important in sonography. To begin, I'd like to explain what nonverbal communication is so you can recognize how often we use it in the healthcare field. Many people believe that nonverbal communication is just a facial expression, but it is so much more than that. According to the Cleveland Clinic in its 2025 article on nonverbal communication, this type of communication includes facial expressions, tone of voice, posture, gestures, eye contact, and even personal space. Put simply, patients aren't just listening to what the provider is saying. They are looking at how they are saying it and how they are carrying themselves when they present this information. Because of that, something as simple as crossing your arms, sighing, avoiding eye contact, or just changing the tone of your voice will send the message that you never meant to send. These nonverbal signals often determine what a patient believes is happening and will have a greater impact on them than the actual words spoken. This is important to understand because if our verbal and nonverbal communication doesn't match, then it will actually cause mistrust. To support this idea, a 2024 study published in Frontiers Medicine by Ismail and colleagues states that nonverbal cues such as smiling and your posture, nodding strongly, affect how communication is interpreted in medical settings. This is because patients often assign just as much meaning to the provider's behavior as they do to their words. Once a patient starts interpreting these nonverbal signals, the impact goes way further than just what they think. It impacts the way that they feel. Positive nonverbal communication helps patients build a strong bond with their provider and makes them feel comfortable, more calm, and emotionally supported. This idea of positive nonverbal communication was explored in a 2024 study published by the Journal of Healthcare Communication, where Kim, Lee, and Park found that all people who were exposed to warm facial expressions and a calm tone of voice all reported feeling comfortable and emotionally reassured when leaving their medical interaction. This study is important because it shows just how quick a welcoming smile or calm voice can make a meaningful difference in your patient's anxiety. So if we can use this kind of communication to ease this feeling of anxiety and stress that they already have walking into the hospital, then they'll be able to leave knowing that they are well supported. On the other hand, negative or emotionally distant nonverbal communication can have the opposite effect. That same study by Kim and colleagues also found that participants exposed to more negative nonverbal behavior reported feeling more signs of anxiety and lower levels of trust in their provider. So even if this information is given perfectly to the patient, just because the nonverbal communication didn't match, it leaves them with a distrust in their provider. In addition to the study, psychologist David Matasimo explained in a 2016 podcast in the American Psychologists Association that people often reveal emotions through tiny unconscious facial expressions that are called microexpressions. He pointed out that culture can also affect how nonverbal communication is interpreted, meaning that patients of different cultures can read provider behavior in very different ways. This becomes even more important in sonography, where we are often being scanned by a sonographer, but the patient is also scanning them. Unlike other healthcare roles, sonographers always have to control their feelings because they find abnormalities but aren't allowed to explain or diagnose what they're seeing. This creates difficult situations because the patient is often looking for answers that the sonographer just can't give them. Because of this, patients watch the sonographer's every move even more closely. And for that reason, nonverbal communication should be treated as an essential professional skill in sonography. In support of this, a 2023 study published in the PEC Innovation Johnson and colleagues found that a communication coaching program for sonographers improved both confidence and communication skills during emotionally difficult situations. This shows that being a strong sonographer takes more than just technical skill. It also requires skills to stay calm and professional and aware on how your nonverbal behavior affects the patient that is laying in front of you. When all of these are put together, it becomes clear that in healthcare, especially in sonography, patients are only being examined physically, but are often reading what people caring for them see just as closely. Today, I talked about how patients often look to nonverbal communication to understand what a provider may not be saying out loud. Then I discussed how those unspoken nonverbal cues affect the patient's emotional response, and then explained why it's important in sonography. Overall, these nonverbal communications is such a powerful tool in healthcare. It affects how the patient understands their provider and influences their trust, and becomes especially important when patients are silently searching for answers.